Sharon, and this is Dr. Postma. She's going to be showing us today some spinal manipulation techniques.
Okay, go ahead and lay on the table if you would for me.
Belly or back?
Face down, please. Okay. So I start out with my patients by examining the spine and the muscles along the spine called the paraspinal muscles to see if there's any tissue texture abnormalities. Basically, those are muscle knots, and she is very tight throughout the upper and lower back and in the neck region. I'm finding some areas that I would consider somatic dysfunction, which is areas that need adjusting. So I do place my hand on either side of the spine. Deep breath in, let it all out. I do a downward thrust as well as rotating. You may or may not be able to hear the popping. That's the sound of the fluid changing position within the joint spaces, similar to when you crack your knuckles. All right. This technique is called HVLA, high velocity, low amplitude. It's one of the 4 techniques, sometimes 5, depending on what school of thought you have, that osteopathic physicians use to manipulate patients' backs. Go ahead and lay on your back for me, please. That technique was called the Texas twist. This technique is called the Kirksville. And basically, I put my hand, the thenar eminence, along the paraspinal muscles. This is the most effective technique for getting ribs back into place. All right, now I'm going to have you bend your knees up. This is a shotgun technique that helps adjust the hips. And squeeze your knees together. Good. And relax. And pull apart. Relax. And squeeze. And relax. And pull apart. And relax. Now lift your pelvis up. Set it down and straighten out your legs. That kind of resets where the pelvis is. And I'm palpating at the ASIS, anterior superior iliac spine, and those are lined up. All right, I'm going to have you lay on your side facing me. This is the technique for getting the lower back in place. Hold on a second, I gotta pull my pants. On your other side, please. Now you don't want to do these high velocity techniques in individuals who have any kind of spinal disorder, such as spinal cord fracture or spinal fractures, spinal cord injuries, anybody who has ankylosing spondylitis, anybody who has Down syndrome should not be adjusted in the neck area. And nobody with rheumatoid arthritis that has any weakness of the bones in the spine should have this technique done. And our neck is very tight as well, and I'm feeling some somatic dysfunction there as well. And only trained professionals should be doing this, and it takes years to master, so nobody try this at home. Close your teeth together. All right. You can go ahead and sit up. All right. Much better. I can move and breathe. Well, thank you, Dr. Postma. You're welcome.
That concludes our viewing of somatic dysfunction and
osteopathic manipulation.
There we go. Osteopathic manipulation. Thank you.